Hi, everybody. Welcome, and thanks to all of you for showing up. It's really great to see everybody. I just have a few announcements before we get started. First of all, on the right side of this screen are some rules of engagement, so please read those and abide by them. There are going to be 2 periods for comments and questions, one after the strategic plan and then one after the discussion of the awards nomination process. So please wait until the question comment periods. And then if you want to speak, raise your hand or put in the chat that you'd like to say something. And otherwise, please remain muted so we don't have distracting background noise. So Kat, can you go to the next slide? Perfect. So the first half of this town hall is devoted to the communication of ARO's strategic plan. The strategic plan, developed by the Long Range Planning Committee and approved by the ARO Council, lays out a plan to fulfill the goals of the ARO mission statement, vision statement, and core values, which are communicated in the ARO webpage in the About section of the website. So Catherine Weiss, who's a principal investigator at NIDCD, is the chair of the Long Range Planning Committee. And she did a wonderful job corralling her committee members to brainstorm and then shape the strategic plan. And she's going to present that to you today. So please take it away, Kat.
Great, thank you so much, Lisa. So yes, my name is Kat Weiss. My lab is at the NIDCD in Bethesda, Maryland in the US. And so I'm here today in my role as chair of the Long Range Planning Committee. So normally what the committee does is we identify and we discuss topics that are of importance to the ARO membership, and we present this to the ARO Council. So the main tool that we use is the midwinter meeting survey or evaluation. So this is actually open right now. So if anyone wants to make their opinions about ARO heard, please fill out the evaluation, which is due this coming Friday. But so this past year, we've been engaged in a larger role for ARO, which has been to generate ARO's first strategic plan. So this is a brief outline of what I'm going to go through today. First, I'm going to talk about why we decided that we need a strategic plan for ARO now. I'm going to bring up the ARO Long Range Planning Committee members who have been engaged in this process, and then go through the strategic planning process that we used, which was the plan promoted by Parthenon Management. And then I'll go through a little bit about the strategic plan structure, which is a fairly unique plan structure for a strategic plan. I'll read through the strategic plan itself, and this will be followed by a discussion of the committee reorganization, which will be presented by Ali Jevons from Parthenon. And after this, we'll have a discussion of some of the change in timing for nominations for our awards. Okay, so why did we decide that we need a strategic plan now? So this was motivated by 2 factors. The first is that the 50th anniversary of ARO is approaching. It's in 2023. So this is a great time to sit back and think about what ARO has accomplished and what we can do to move forward. So the second is that we changed to a new management company a couple of years ago, which is Parthenon Management. They've really been a wonderful partner to ARO for the past couple of years. They have extensive scientific association experience, and they recommended that ARO go through this process to assess the state of our association and actively take steps for future improvement. So we're following Parthenon's recommended structure for creating the strategic plan. So this plan is meant to build a cohesive framework to structure ARO activities around, which includes the midwinter meeting, but it also includes the new functions that ARO has been involved in increasingly, such as our year-round seminars and more mentoring within ARO. So thinking through this plan has also been happening in parallel with updates to the bylaws, which I hear have not been updated generally since 2004. So this is all in need. And there's also the committee restructuring that will be discussed later. And this will help to keep ARO nimble and influential for the years to come. So you also may notice that some of the ideas detailed here are actually already in progress. We have a really wonderfully active ARO Council and wonderfully active ARO committees who are doing a ton of great work. So some of the work here is to formalize and codify the work that is already in progress. but also the strategic plan is about generating new ideas for ARO. So these are the members of the Long Range Planning Committee that have been involved in the strategic planning for the past year. So I really want to thank the members of the committee. We spent the past year meeting regularly, and we thought deeply about ARO and discussed ARO, what we think is great about our association and what we think needs improvement. So we had a lot of very open and detailed conversations on a range of topics. And then we finally distilled all of this down into the plan that I will present today. So thank you all in the committee for your really fantastic work this year. It's been a lot of fun. We've had great conversations and everyone's been very dedicated to ARO and its continued improvement. And it's really been a great team effort. And I also want to thank the members of Parthenon Management who led us through the strategic planning process, including CEO Sarah Tim, Ali Jevons, who I think a lot of us have gotten to know. She is the Senior Project Manager and she is exclusively with ARO. Dawn Kegler, who is the Director of Association Management, and Julie Hiscock, who is Member Services Manager. So thank you very much to everyone at Parthenon for all of your involvement with this plan. And they've been guiding us at every step. So I'm going to step through the process for strategic planning. The first step involved a large effort from multiple members of the ARO community, including ARO Council and the committee chairs. So this meeting was in October of 2020. It was led by Parthenon Management, particularly CEO Sarah Tim. And what we did during this meeting was to get into small groups and perform a SWOT analysis, which is strengths, weaknesses, opportunities, and threats. So during this analysis, a number of themes emerged, including a need for improved meeting services, including closed captioning, support for our diverse membership, mentorship across ARO, and better support for our global community. And so there was also a lot of discussion about our very rich history, the strength of our midwinter meeting, and our amazingly active student and postdoc association, Sparrow. So next, the results of this SWOT analysis were summarized and presented to the Long Range Planning Committee, who then took on the rest of the strategic planning. So we reviewed the SWOT analysis results, and this provided an initial framework for the strategic planning brainstorming process. So the full LRPC, along with Ali Jevons and Dawn Kegler, we spent a few meetings just discussing some of these themes and doing a lot of brainstorming. And then we distilled these ideas into three main topics that became our strategic plan goals. So the three main goals for the plan involve roughly the ARO community, science and innovation, and our outreach and advocacy. So the next step was that these three goals were approved by ARO Council, and then the LRPC returned to meetings, but we did so in smaller subgroups of about 5 to 6 people. And in these smaller groups, it really facilitated in-depth, detailed discussions to work on more detail for each of the goals. So we worked in collaboration with Ali and Dawn to formulate the final text that we'll go through today. So we have completed the strategic plan, but there is still one more step to this, which is now that we've done the larger strategic plan, we will pass along the plan to the ARO committees, who will be following up on some of the detail work for the plan. Okay, so this plan has a fairly unique structure. It's actually the third type of strategic plan that I've been involved in scientific associations recently. And this is a unique plan in that it is very much a broad, high-level plan. It's just a 10,000-foot view. So by design, we were supposed to think about the entire organization, come up with a big picture, cohesive plan. And this is also in an outline format, but has nested levels of detail. So it has some fairly sparse language compared to a lot of other fairly wordy types of plans, but I think it makes it a very impactful plan. And it is written with a fairly management style of writing. So as I have mentioned, we have three overarching goals of community, innovation, and outreach. Now, within each of these three goals, there are objectives, which is still about the what we want to accomplish. And for each goal, there are 2 to 6 objectives. So some examples of this are that within our goal on community, There are multiple objectives, and each might be centered on a particular issue that we think is important to ARO, such as global engagement, accessibility and accommodations, and diversity, equity, and inclusion. So within each objective, there are then 2 to 7 strategies. Now, the final level of detail is the tactic. And so the tactic is the real detail of this plan, which is the who, the what, when, where, why, and how of the plan. It includes who might pay for the plan. And so this is the real fine-grained detail, but I want to point out here that this final level of detail is by design, not a part of the formal strategic plan that I will present. So the idea is for the LRPC to come up with the high-level view, but then we leave the real details to the people with the expertise, which are the members of each of the ARO committees. And so I will say that not going into tactics was fairly difficult for the LRPC. We came up with a lot of really great detailed ideas, but we had Dawn and Ellie present in all of the meetings to help us say, no, that's a little bit too much detail. We're going to leave that to the committees, stick to the broad high-level plan. So what I will present today is this larger goal, objective, and strategy format. And then the next step has been organized by Allie and Dawn, who have taken all of the various strategies that we have come up with and distributed them to the individuals and committees that have the greatest expertise. And these committees will determine the feasibility and carry out the final steps of the plan. And so it will be up to the committees to decide on the tactics. Okay, so now I'm going to go through the details of the strategic plan itself. So as I mentioned, we have 3 main overarching goals for ARO. We are thinking of these as setting the priorities for ARO. The first is community. Goal 1 is to build a diverse and supportive member community. Goal 2 is innovation, to enhance innovation and cross-pollination. The third goal is outreach, to elevate the outreach and societal impact of ARO. Okay, so goal 1, build a diverse and supportive member community. So first, I want to thank the individuals that served on the subgroup for this community goal. So we were joined by Lucas Landiger, who is also the chair for the International Committee, Bonnie Lau, Chris Shera, Kira Pasuthikar, who is a postdoc who represented Sparrow, and myself. And in all of these meetings, we were also joined from Parthenon by Allie Jevons and Dawn Kegler. So what I'll show you today is the nested structure, the outline structure, and this is the plan. It will have the goal, an objective, and multiple levels of strategies. So the first objective in our community goal is to provide supportive services to members for optimal member experience. And the first strategy within this objective is to develop a new member welcome process. Next strategy is to develop year-round messaging to help members navigate member benefits. Next strategy is to expand the ARO website to include in-depth information on committees, leadership, and pathways to involvement. And the final strategy for this objective is to broaden the information featured in the ARO membership directory and its search features. Now I'm going to show as an example for just this objective what the next steps will look like, which is that the first 2 strategies will be followed up on by the membership committee. And this is actually a new committee, which will be described by Allie following the presentation of the strategic plan. And then the next 2 strategies will be followed up by the executive office, which means Parthenon management. So for every one of these strategies, Dawn and Allie have gone through and decided which group or people or part of the council or the executive office will be the best to follow up on the details. So the people with the expertise for each of these strategies in order to carry them out. But for the remainder of the plan, I'll just step through the goals, objectives, and strategies. So objective 2 for our community goal is to provide opportunities for global engagement and collaboration. So we want to establish a regional liaisons program to connect international members and enhance engagement. Strategy is to provide opportunities for networking and collaboration outside of the midwinter meeting. We want to explore and implement technology and social media forums that assist members to communicate with ease. develop year-round virtual programming, excuse me. And finally, to explore the viability of small international events. And we hope that this goal will really help to make ARO a global community with engagement for everyone part of the association. Objective 3 is to improve the accessibility and accommodations that ARO provides to our community throughout the year and at the midwinter meeting. And we actually have a new accommodations committee that has already been doing some great work for the past couple of years. One strategy is to implement cutting-edge assistive technology to provide accommodations to our members. The next strategy is to evaluate mechanisms to improve access to all aspects of ARO programming. So not just podium sessions, but networking, social events. Next strategy is to communicate best practices for full inclusion of our members in ARO activities. And the next is to explore options to provide access to ARO activities to our members with caregiving responsibilities. The fourth objective is to encourage and promote the scientific diversity of ARO members. The strategy is to highlight the work and achievements of members across the globe. The second strategy is to expand and promote the ARO Speakers Bureau, both internally and externally, for optimal utilization of member expertise. The fifth objective is to promote initiatives to make ARO a model of support of diversity, equity, and inclusion. First strategy is to improve the communication of ARO programs supporting diversity to the membership. So we're already doing a lot of great work, and we really want to communicate this to everyone. The next strategy is to maximize the Diversity and Minority Affairs Fellowship Program. Third strategy is to attract and maintain young persons to the ARO community. And the last strategy is to identify underrepresented countries and regions and develop an outreach plan to recruit members from these areas. Objective 6 is to develop year-round career-spanning educational programs. The first strategy is to conduct an annual needs assessment to identify the educational needs of ARO members. The second strategy is to expand the current year-round ARO mentorship program, which is currently run by Sparrow and geared towards our trainees, to a formalized and career-spanning program, because we all need mentorship at all levels of our career. The third strategy is to further develop the ARO seminar series to a robust virtual learning program relevant to all ARO members. So overall, overall goal 1 aims to continue to build an ARO community in which all members, so all career stages, scientific disciplines, locations, abilities, backgrounds, feel welcome and feel included in what I feel is already a very vibrant ARO culture, but we can still do better. Goal 2 in the plan is to enhance innovation and cross-pollination. So this goal is really about our science. So this is intended to be both within ARO and with the broader scientific community. So I think we all realize that ideas can come from very unusual places, and that the more that we talk to each other, the better our science will be. So this includes efforts to improve our communication across basic translational and clinical science, and to bring information about new methods and technologies to our members to enhance the great science that we're already doing. So the subgroup members that were involved in the innovation goal were Ksenia Gedideva, Lisa Goodrich, who is the past chair of the LRPC, Marlon Hansen, Matt McGinley, Stefan Heller, and myself, and with Ali Jevons and Dawn Kegler from Parthenon. So thank you for all of your work for the detailed work of the innovation goal. So the first objective for our innovation goal is to encourage interactive involvement of educational and scientific partners from other organizations at the midwinter meeting and beyond. The strategy is to host and/or participate in joint meetings and virtual seminar series with researchers outside of the ARO community that speak of mutual interest. The next strategy is to promote the ARO journal, JARO, both within the ARO community and with our scientific partners. Third strategy is to explore ways to promote the ARO midwinter meeting and encourage like educational and scientific organizations to participate in ARO events. And then the fourth strategy is to develop an ambassador position to maintain communication channels with other organizations, including those within clinical otolaryngology. And this can include also groups that do techniques training courses and funding organizations. Objective 2 is to promote cross-pollination across the ARO community. And this is about giving us more opportunities to interact with people doing research different from our own to promote our innovation, creativity, and collaboration. Strategies are to introduce interdisciplinary panel discussions at the midwinter meeting or virtually throughout the year that do not conflict with other focused midwinter meeting sessions. The next strategy is to expand the number of clinicians presenting keynote sessions at the midwinter meeting. The next strategy is to develop a special interest groups program. Next is to explore the development and promotion of a forum for the purpose of techniques training, but with an emphasis on trainee-driven, cutting-edge techniques dissemination. The next strategy is to explore mechanisms for cross-lab training opportunities. And finally, to promote bench-to-bedside research to improve patients' lives. So as I mentioned, goal 2 is really about our interactions with each other. And this is to promote our innovation and creativity and hopefully our collaboration as well. So goal 3 is to elevate the outreach and the societal impact of ARO. So we are really generating fantastic new knowledge from basic science through clinical research and potential therapies. And we want to disseminate this information to the general public to understand or to advance scientific understanding, and also to patients with hearing imbalance disorders to universally improve hearing and balance health. And so here's the individuals who are on the subgroup about outreach and advocacy. Larry Hoffman, Lisa Olson, who at the time was the president-elect to ARO and is now the ARO president, Jonathan Siegel, Ruben Stepanian, Aaron Tord, and myself, and with Ali Jevons and Dawn Kegler, as always. So the first objective in goal 3 is to increase impact through collaboration and advocacy. The first strategy is to strengthen the relationship with other institutions and organizations where ARO can make an advocacy impact in our focused areas. And the second strategy is to create a liaison position to facilitate communication between ARO and advocacy groups for mutual benefits. The second objective is to increase clinically focused initiatives to enhance the ability of ARO to improve patients' hearing and balance health. First strategy is to explore mechanisms of enhancing patient access to clinical trial opportunities. Next strategy is to create a forum for presentation of clinical trial and clinically relevant results at ARO. And the third strategy is to explore funding mechanisms to allow the ARO membership to attend other clinically focused meetings. Then objective 3 is to enhance outreach to the public through education. First strategy is to explore making sessions that are relevant to the public at the midwinter meeting available to the public. Second strategy is to pursue opportunities for co-sponsored in-person events and virtual content targeted at the public. The third strategy is to create mediums friendly to the public for sharing scientific content. So this goal is about disseminating our science to the public for education and for patient health. And it's also about interacting with advocacy groups to see how the needs of patients can inform the science that we do. So to sum up, we have created a strategic plan that has been built with the idea of supporting ARO's vibrant community, our scientific innovation, and our outreach to the public. So as I mentioned, this plan is indeed a broad and high-level direction for ARO, and it sets our priorities for the next 3 years. So much of the detail of the tactics, that last level of the outline, is missing, but this is by design. And so we will now hand off the plan to the committees with the real expertise in these areas, and they will be able to do their own brainstorming to further the mission of the ARO. And so now I'm going to hand this off to Ali Jevons, who will step through some of the committee reorganization. So I'm going to stop sharing here.
Great. Thanks, Dr. Weiss. All right. Okay. First, I just want to say that it is or has been an extreme pleasure working alongside Dr. Weiss in the Long Range Planning Committee. This has been well over a year-long process. We met several times, and each time I felt like we had extremely engaging discussions, and it is so clear that ARO has extremely passionate members, which is just a pleasure to work alongside. So with that, we're just going to walk pretty quickly through the committee restructuring. And this was done so that ARO could achieve its full potential in the strategic plan that Dr. Weiss just outlined. So first, we're going to look at the current ARO committee structure. We have the Long Range Planning Committee, Dr. Weiss, who is the chair, the International Committee, the Diversity Minority Affairs Committee, Finance and Investment, the program, who's in charge of your fantastic midwinter meeting, the Awards Committee, the Accommodations Committee, which was new as of late 2020, the Travel Awards, and the External Relations. These committees on the bottom, while extremely active around the latter half of the year, function predominantly around the midwinter meeting, but they do incredible work, necessary work, but I just wanted to point that out. So here is the voted on restructuring for the ARO committees. All of the committees we just spoke about will remain as they are because they are vital to ARO and have gotten you to the successful society you are today. We have proposed and have been voted on and accepted to add 3 committees. The Communications Committee, which is going to be made of a liaison from each of the already existing committees to ensure that the initiatives are being marked on the website, social media, and letters to membership. We just want to be sure that all of the initiatives you all work extremely hard on are being promoted and shared. That's great. This is the one that we're going to talk about the most, is the international morphing into the membership. This by no means is the erasing of the international committee because ARO's international community is vital to its success, but rather it's making them from an other to the core part of who ARO is. We want to be sure that there's international mindset on every committee and that we are being sure that internationally located individuals are at the heart of what ARO is doing because you are a true international society. We spoke at length about this name change with the committee and among council. And at first we had some discussions about maybe why we wouldn't want to do this. But after a while, the International Committee has decided that they feel this makes them stronger within the community, as well as allows them to impact everyone involved in ARO, not just those who are internationally located outside of North America. I do want to add that this change of the membership committee has been added into the bylaws, that it will be co-chaired, required to be co-chaired by the current chair of the International Committee, who was located outside of the North America, and it has to have a co-chair who was based in North America. That way we are being sure that we are representing both international and North American-based membership. And lastly is the Virtual Learning Subcommittee. They are a group of extremely dedicated ARO members who have created some of the initiatives you all know and love, such as the seminar series, the coffee hours, and they are going to be made into a formal committee, the Education Committee. We're hoping that this just keeps going and creating these great interactive events that you all have joined, and that they are supported by ARO in a true way rather than just being a subcommittee. All in all, that change is just to be sure that it is formalized in the processes that they are doing rather than just being a group of dedicated members. So with that, this is going to be our new committee structure. We think it's going to make ARO stronger and just reinforce the strengths that you all already have. Again, it's been a real pleasure working alongside Dr. Weiss and the Long Range Planning Committee. We've enjoyed every step of the way, and I cannot wait to see where ARO goes in the next couple of years with this restructuring. I think that nothing but the best can come. So with that, Dr. Olson, I will pass it back over to you. You are muted, Dr.
I'm muted, just like I told everyone to do. Does anyone have any questions for Kat or for Allie on the strategic plan? And it's very impressive, I must say. I mean, it just looks so solid and really good. So I'm really thrilled with it and with the work that that Kat's done. Any
committee effort. It was a big team effort. Everyone did a great job.
Yeah, you corralled your committee though.
That was easy.
Good leader. So anyway, it doesn't look like, I'm just looking at the chat, I must say, because there are 68 people. If anyone wants to say anything, can you please put into the chat? Okay, good. Paul Fuchs. So Paul, go ahead and unmute if you want to say something.
Well, it's not that important to say it personally, but I'm just curious to know whether it was discussed as to whether we would continue to maintain a virtual format for future ARO meetings.
So, oh, yep, Ally probably is best to handle it.
Absolutely, that's a great question. So the program committee has not met to discuss what types of options we're going to be adding into the meeting moving forward. That will be something that we'll talk about with the chairs, Dr. Matt Kelly and Dr. Steve Lomber, when the time comes. But great question. Dr. Olson, I did want to know, we have a hand raised of Dr. Ed Rubel.
Oh, okay.
Thank you. That was a great presentation, Kat and Ally, and I commend you on all that work, and I think it's a great thing for ARO to do. But I wondered why you didn't bring up a question that's been floating around since ARO started, and that is ARO a hearing and balance society, or is ARO an otolaryngology head and neck surgery society that represents research in all areas of otolaryngology and facilitates research in all areas of otolaryngology? That's a question that we've been asking since I started, which was the second meeting of ARO.
Yeah, I think it's a good question, and we tried to be careful with how we worded some of the things in this, and I think that it comes up most in the mission and vision statements, where we really didn't want to limit who we include in this society. So I'm not sure that I'm quite the right person to define it, but our goal was to, and I should pull up the mission and vision statements. I don't have them right in front of me, but
They're in your, actually they're in your presentation if you still have that, because they're in the very
roll up
second
through my,
slide.
yeah, I suppose I can pull that up. How did we phrase that? So this was, I have to look through this. We said hearing and balance and related otolaryngological fields as the committee's best way to make this including everybody who is involved in ARO now, and everybody to really be inclusive and not try to restrict who feels a part of this organization. I know that that really doesn't answer your question. I guess I'm not quite sure how to answer that question.
But having been there during those discussions, I must say this was a point. This was a point that definitely was discussed. And so I think your point is well taken. It's a hard question. And, you know, those mission and vision statements were crafted in a way to sort of put people's thinking as best as we could.
Or can I say to friends, avoid that question?
Yeah, to not restrict.
Okay.
Mhm.
Oh, there are a couple questions in the chat. Maybe I'll read them and then we can talk about them. One is from Jonathan Kill. Are there any defined membership targets? Increasing MDs, MD PhDs, international percentage, or attendance presentation targets?
So I don't think so. I think there are restrictions about probably some programming and management related considerations about things like conference halls and things like that. Ally, you look like you had some things you wanted to add.
Sure. This is a great question. So it's hard because we're at such a high view, but once these initiatives go to the new membership committee, it'll be up to them. But currently, as part of the plan, that wasn't put in there just because that's so rather black and white, rather than making room for the membership committee to decide the best course of action for the, strategies. So currently, no, we don't have any set. We wish to see MDs increased by X percentage. But I am happy to say ARO has been growing at a pretty healthy rate. You all are so engaged that it's been really wonderful to see, and your meeting membership attendance has has stayed the same. You actually had your record in 2021. So that's really exciting. Dr. Olson, may I read the next question?
Sure. Yeah.
We used to have a membership committee, but that was disbanded several years ago. So I am just curious as to how the new membership committee will be different. I think that's a great question. One thing is that this plan already lays out a few initiatives that we have for them. But the second is that we're very much dedicated at Parthenon to being sure that you all engage your membership the way that you want to be engaged. So we're going to be working alongside you. Nothing will be done on your own. So we'll be sure to keep initiatives moving forward, and that if maybe something doesn't work, we tweak it. But we're going to be moving forward with initiatives to be sure that you're all engaged in the way that you wish to be, or that's fruitful for your community. That's a great question, Dr. Cox.
So any additional questions? I don't see any hands raised. I'm trying to scroll through everybody here, but put it in the chat if you wanted to ask another question, and you can. But if not, maybe we can go. Well, first of all, thank Kat very much for all her work and her committee's work, which really is a tremendous effort and really exciting to see all this stuff codified. So now we can move on to the second part of the of this, and for that I'm going to